Hello, viewers, and thank you for joining us for this, the second segment of a series on the Central New Hampshire Medical Reserve Corps, known as MRC, and the Community Emergency Response Team, referred to as C.E.R.T. Today, we will showcase the importance of community partnerships in Central New Hampshire's regional public health efforts. Community partner engagement is essential, and here in Central New Hampshire, there are many valued and established community partnerships that are critical in serving vulnerable populations. Let's meet a few of them and learn how the public health partnerships interface with Central New Hampshire's Regional Public Health Network and the MRC and C.E.R.T volunteers. Angel, can you share with us how the MRC volunteers and C.E.R.T volunteers and the regional partners fit together in the Central New Hampshire Regional Public Health Network?
Hi, Dan. The Central New Hampshire Regional Public Health Network, the RPHN, is made up of 18 communities, seen here.
Regional volunteers, the Medical Reserve Corps, and Community Emergency Response Team, along with community partners, work jointly with the RPHN supporting public health throughout the Central New Hampshire region. The Central New Hampshire Regional Public Health Network also has established partnerships such as AmeriCorps, a federal agency that funds organizations to make positive impacts in their local communities.
Let me introduce you to Haley Myers, the current AmeriCorps member working with Central New Hampshire MRC and C.E.R.T. Haley, can you tell us briefly about AmeriCorps?
Sure. So AmeriCorps is a federal program that promotes public service within the U.S. While members are serving, typically 1-year-long terms, they receive a stipend, and when members complete their term, they can receive up to a $7,000 educational award. There are different kinds of AmeriCorps programs, though, that cater to people of different ages, the term lengths that they would prefer to serve, as well as their areas of passion. Mine is public health, so this has been a great fit.
The MRC and C.E.R.T units and community partners support New Hampshire public health initiatives. Angel, can you describe some of the statewide public health programs the volunteers are involved in?
Our region has several ongoing initiatives. School-based vaccination clinics have been operating since 2009. This is a voluntary opportunity for schools throughout the Central New Hampshire region to host an influenza vaccination clinic reaching school-aged children who may not have a primary care provider, who experience hardship getting to a location to receive the vaccination, and/or whose family may otherwise not have the financial means to cover the cost to receive the vaccination.
So I'm here at the Plymouth State University Nursing Simulation Lab, and joining us is Chantel LaPlante, the Nursing Clinical and Lab Coordinator. Chantel, can you share how school-based clinics fit into Plymouth State's mission?
Absolutely. Our motto at Plymouth State University is Ut Prosim, which means that I may serve. And we are doing just that by participating in these vaccine clinics. We are bringing vaccines to school-aged children and the staff that work at the schools, and we are serving the community.
How do the clinics fit into the nursing students' curriculum?
The clinics fit in a few different ways. The students actually learn how to administer vaccines through an intramuscular injection in our skills lab first. And then they do online training that is provided by the state. And then we bring those two trainings together in a mock clinic on campus where the students actually vaccinate each other for the flu season. And then we move forward in a culminating learning experience where they actually vaccinate children and staff in the schools. Through participating in these clinics, students get to practice professional communication, working in an interdisciplinary team. They learn how to follow instructions and written medical orders and protocols, and they also learn how to prepare for medical emergencies, such as a possible reaction to a flu vaccine.
And how can you see this collaboration benefiting public health in our local communities?
So with students participating in these clinics, they are helping to address multiple barriers of our rural area, such as transportation. We're meeting the students at the schools. Financial barriers, the students are not paying for these vaccines that are being given, and they don't need to make a doctor's appointment, right? It's all sort of one package deal and it just makes it easier for students and staff to access the vaccine.
Joining us to discuss the school-based clinic initiative is Haley Hay, Spear Hospital's Staff Development and SAU 48 School Nurse Director. Haley, what benefit to both the local schools and local medical providers do school-based clinics offer? Do you want to start out with the benefit to the schools?
Sure. The flu and other respiratory illnesses can spread really quickly throughout schools and childcare facilities. So we're really fortunate that we are able to offer these school-based clinics to our SAU 48, which helps keep our community and schools healthy. It's great for the working families too, for parents and guardians who are not able to leave work to take their child to the local pediatrician or primary care provider office to receive the vaccine. It's also great for our staff at the schools because they are able to participate if it's appropriate and desired.
Would you share benefits to the medical providers?
Absolutely. Having the students get vaccinated at the schools can help to free up the provider schedules and offer more flexibility.
Can you touch on the value of working alongside the Medical Reserve Corps and Community Emergency Response Team to provide the clinics?
Of course, as you know, many of the volunteers are retired medical providers, and they're returning year after year. So I've had the pleasure of working with them for the past few years myself. I think it's helpful for the students when they come back every year and they see returning faces. It's nice that from the time the student walks in till the time the student leaves, they're informed about the entire process, and the volunteers enjoy seeing the students, and they even remember some of the returning faces that are coming back from the previous year.
Are the other statewide public health initiatives the MRC and C.E.R.T teams work on to educate the community on?
Yes, some other public health initiatives are focused on radon awareness, tick-borne diseases such as Lyme. Some unit responses have included opioid misuse. Activities started in 2015, declared a public health incident in New Hampshire. The unit conducted community education sessions and Narcan distribution throughout the region. Another was when New Hampshire declared hepatitis B a public health incident in 2018. New Hampshire was one of 33 states that identified hepatitis B as a public health incident. We worked with mental health professionals, faith-based communities, medical providers, and social services to support the vulnerable populations in offering hepatitis B vaccinations throughout the region.
Angel, can you share with us some of the other examples that C.E.R.T and MRC units reach?
Sure. The unit supports both emergency and non-emergency community requests. We have about 25 activations per year. Non-emergency community activations can include support during local events such as health and town fairs and races. The National Night Out and the Hebron Fair are great examples. The unit also provides public health information, first aid, and traffic control upon request. The Hebron Fair has been going on for over 70 years. Let's hear from the event organizers and planners, Hebron Emergency Management Director John Fisher and Hebron Fair event co-chair Bill York, on how they collaborate with the Central New Hampshire Medical Reserve Corps Community Emergency Response Unit to put on this long-standing event. John, can you please describe Hebron's relationship with the Central New Hampshire C.E.R.T and MRC?
Yes, it goes back quite a few years now. I've said at least a decade, probably a little more. And it helps us to meet the challenges of the logistics of that Hebron Fair. There's 4,000 people, as a rough guess, that participate in that come from all over New Hampshire and beyond, and finding parking spaces for them in the little town of Hebron, managing all the pedestrian traffic on the state road in the middle of Hebron can be a real challenge. And those folks from the MRC and the C.E.R.T really just carry all their weight in helping to promote safety and the security and the organization of the movement of people at the Hebron Fair.
And Bill, As the Hebron Fair Committee co-chair, you also interact directly with the Medical Reserve Corps Community Emergency Response Team. Can you describe the MRC C.E.R.T's role at the fair?
Sure. As John had said, they help us with two critical elements for us. One is parking, to be sure, and the second one is helping us with pedestrian traffic, because we don't have any main gates or anything like that at the Hebron Fair. The whole common area is wide open. So we have people coming from every direction you can imagine. And the C.E.R.T's people have always been great in helping us with traffic cones, that sort of thing, watching people crossing the street, making sure everybody is very careful and safe. And the parking is another, obviously a big issue there. But one of the new things recently has been the van that has been on the common, providing first aid, elementary first aid. So we're pleased to have them and look forward to many more.
Angel, you've mentioned that the public health community education information and presentations, but can you expand on what MRC and C.E.R.T offer?
The Central New Hampshire MRC and C.E.R.T units have offered public health education to the community throughout educational material and information sessions at local libraries and community centers. Fire safety, hiker safety, and how to prepare for a long-term outage are some examples.
In the most recent years, there's been a lot of activity around the COVID-19 pandemic. Can you share with us how MRC and C.E.R.T has worked with other partners during this pandemic?
Initially, late in 2019, early 2020, in collaboration with the state, I distributed situational awareness information to partners while developing plans and partnerships with organizations to provide COVID testing and later vaccination opportunities. In March of 2020, the regional public health networks received the directive to stand up an acute care site in every region. For Central New Hampshire, this was a real reflection of the strength of our partnerships. In very short time, we had all our regional emergency response trailers unloading at Plymouth State's ice arena. Spear Hospital was the lead for Central New Hampshire's acute care site. Plymouth State University offered their ice arena as an acute care facility. Once New Hampshire had COVID vaccine, the regional public health networks were activated to operate mobile vaccination clinics throughout the rollout phases, serving vulnerable populations.
Plymouth and Bristol Senior Center Director Gail Shaw is here to speak to this topic of cooperation and interaction. Gail, can you describe how the senior centers have interfaced with Central New Hampshire's Medical Reserve Corps and Community Emergency Response Team?
Yes, I'd be glad to. In November 2019, Angel approached me about renting a small office at Plymouth Regional Senior Center. Her positive energy and sense of fun made it an easy decision to welcome her as our Regional Public Health Network Coordinator, Emergency Preparedness Coordinator, and the MRC C.E.R.T Director. She wears a lot of hats. Soon after settling in, COVID changed our lives. Angel stepped up and coordinated with her regional volunteers multiple mobile vaccination clinics right in our parking lots at both Plymouth and Newfound Senior Centers. She then set up the follow-up clinics for second dose shots with the volunteers again. She provides us and many others with COVID tests, masks, and an amazing amount of reliable information. In the midst of the pandemic, this was wonderful. Angel keeps us well informed about other public health concerns and is a well-known and loved member of our senior centers. She has participated in at least 2 health fairs that we have hosted. I look forward to getting her emails. They always offer pertinent information about many different aspects of community health and prevention. As a grandmother, I appreciate Angel and the team's involvement with our local schools as well. Thank you very much.
Mays Place Administrator Megan St. Germain is also joining us to share what it meant for your residents and their families to have the clinic come to the long-term care facility.
Having a group of volunteers come during COVID, which was a very stressful time for everyone, was unbelievable. They came, they set up. Any of my residents and staff who chose to have the vaccine got it without any issues. The families of my residents were so happy to know they were so protected here, and I can't say enough. The volunteers were unbelievable. They made a stressful time a little bit better.
Countless organizations from all sectors contributed to Central New Hampshire's COVID response efforts. Linwood Ambulance Service, based out of North Woodstock, New Hampshire, was a significant contributing partner. Ken Chapman and Marty Talbert are here to share their impacts of their team and the collaboration in working alongside the Medical Reserve Corps Community Emergency Response Team volunteers during these largely outdoor vaccination operations. Also vital during COVID response efforts were the coordinated strike teams vaccinating homebound residents throughout the region. So, Marty and Ken, thank you so much for being here. Can you speak a little bit about the service's commitment to public health?
The ambulance service is a not-for-profit organization formed by the two towns back in the early 1970s. Since then, we have provided a wealth of services. Nearly nowadays, over 800 people a year take advantage of the ambulance services. We also have a community program of strong putting AEDs in the community. Help Save Lives is started off with 5, and nowadays we have over 70 AEDs in our community. Mm-hmm. In fact, just this week, 2 days ago, an AED saved another person's life. And it was at noon. The guy was talking by the time the ambulance crew got there.
Can you speak a bit on the vaccination clinics, and working alongside the C.E.R.T MRC volunteers?
We loved working with them. It was a great organization, and you as Angel has, spearheaded it and got us all lined up and so forth. Linwood Ambulance was a big part of that, which was a great community service that we could provide, and we were very happy to do that. And then we spread out to the other towns as you needed volunteers. So everything was very well controlled, very well orchestrated. It was very cold, lots of days, but I know our community was very grateful, and they even talked about it even to this day. I saw someone the other day at a going away party, and they said how wonderful that program was, and we're very grateful to it. So,
yeah. Well, you also were a significant partner in the homebound vaccination strike teams. Can you touch a little bit about that?
Yeah, you picked different partners to go out with that was available, and we went to different homes all over some nice area, Rumney, and we went very into the boondocks and had to ask directions because the GPS wouldn't even help us on that one. But we enjoyed going into seeing people and talking with them and giving them a vaccination, and it was a big service that we were happy to help.
Right.
Absolutely. Well, we thank you for all of your contributions for the public health of our region.
We're ready to do it again. If you need us.
Excellent.
Angel, what can you say to encourage people to join this effort?
First, I want to give a special shout out to all the regional partners who've helped in countless ways over the years. The commitment of our partners and volunteers is what makes Central New Hampshire an amazing place to live. The Medical Reserve Corps, Community Emergency Response Team volunteers, and organizational partners are essential. The Regional Public Health Network could not have the community impact without its dedicated and talented contributors. For those who want to make a difference in our local communities, the MRC and the C.E.R.T is a wonderful way to serve our communities.
Thank you for joining us. We hope that you have gained more awareness on the importance of community partnerships here in Central New Hampshire's regional public health efforts, and how together, alongside Central New Hampshire's MRC and C.E.R.T unit, we can make a difference in the health of Central New Hampshire residents. Please join us for the next segment of this series outlining how the Medical Reserve Corps and Community Emergency Response Team fit into New Hampshire's public health model. Viewers can connect with the unit to get further information about the Central New Hampshire's Medical Reserve Corps and Community Emergency Response Team units using the information on your screen. Thank you and take care.